So I'll read the question for you. So this is a matrix multiple response question. It says at 1300 hours, an 86-year-old client with altered mental status who is accompanied by their child is admitted to the med surgical unit, and the nurse is performing an assessment. The client has an IV solution of a 1,000 ml bag of normal saline hung at 12 o'clock in the ED that is infusing at 100 mLs per hour. 1 hour after admission, the client child calls the nurse and reports that the client has a pounding headache and is having trouble breathing and seems scared. Okay, so are our wheels in our heads thinking like, what could this be? All right, so then you want to look at your nurse's note. It says at 1300 that the client is weak and reports have not being able to eat or drink in the past 3 days because of anorexia. Her skin is very dry. Her mucous membranes are dry. She's sleepy. The child reports that the client has a history of heart failure, hypertension, and hyperlipidemia. The breath sounds are clear bilaterally. The patient medications are lisinopril, cardovolol, and digoxin. At 2 o'clock, the client is dyspneic, meaning short of breath, and complaining of chest tightness. She is coughing and she is pale. She has neck vein distension. Breath sounds are wheezing and they can hear congestion bilaterally. There is only 500 ml of fluid remaining in the IV bag. All right, nursing students, so I hope your wheels in your head are starting to turn and be like, oh, I know what happened to this lady. I know what happened. All right, so we then look at our test results. So what I love about Next Gen is, guess what? They let you know the normal ranges and they tell you if it's high or low. So, but it's up to you to know what these lab values are associated with and why they would be high and why would they be low. So guess what? It takes some critical thinking on that part. So the BUN is elevated. The creatinine is elevated. The digoxin is elevated. The sodium is elevated. The potassium is elevated. Everything is elevated on her. Her vital signs, the only vital signs that seem to change from when she first got in there was her heart rate was 72. Now it's 110. Her O2 was 90. Now it's 89. Her respirations were 24. Now they're 28. And her blood pressure was 100/68, but is now 152/98. Do we have any idea of what is going on with this patient? So now let's go to the question. So the question reads, for each assessment finding below, specify if it's most likely consistent with dehydration, circulatory overload, or digoxin toxicity. So here comes in where we need to have content on dehydration presentation, circulatory overload presentation, and digoxin presentation. It doesn't even say that the nurse gave the patient digoxin, but guess what? This would be a perfect time to see, do you know your medications? All right, before I shout out the answers, I'm going to give you guys a little time. I'm going to give you guys 30 seconds just to see if you can answer the question. And you only pick one per assessment finding. All right, so anorexia. Would you most likely see anorexia with what? Digoxin toxicity. Dry mucous membranes, we will see that with what? Dehydration. BUN and creatinine levels. Being that their levels are high, we're going to see that with what? Dehydration. Because now the kidney is not working properly Because what? It is not getting enough fluids, right? The sodium and potassium levels, they are high. So we know that sodium is excreted through body fluids. So when your body is dehydrated, your kidneys are saying, guess what? I'm going to hold on to every ounce of fluid that I have. It goes into survival mode. And that's when all your electrolytes start to go. So you know how sodium follows water? Well, guess what? No water is being let out. So guess what? Sodium is being, sodium's not being let out because there is no water, right? So there is no sodium and water to follow each other. So guess what? Your sodium level is going to be very high because guess what? There is no water. Why? Because that patient does not have any fluids. All right. You're going to see, and all that is going to be in dehydration. Your digoxin level, that level is high. And guess what? We're going to put that with what? Digoxin toxicity. All right. You see an elevation in your blood pressure and in your heart rate. What is that? What caused that? Because when grandma came in, her blood pressure was low and her respirations were normal. As soon as they started those fluids on her is when everything changed. So I hope that you made that connection, that as soon as they started those fluids on her, everything changed. So that would be circulatory overload, wheezing and congestion bilateral in her lungs. That's circulatory overload. And neck vein distension, that is also circulatory overload. So what might have happened in this case was, which happens all the time, we don't really dig into the patient's chart. So if we would have took in account, if we would have took in account the lady's age, knowing her kidneys probably, have slowed down. So guess what? They hold on to fluid. But most importantly, she has a history of heart failure. And we know with fluids and heart failure, if you don't run them super slow, they can be easily pushed into fluid overload. So you want to make sure that you are paying attention to their health history. Their health history is very important. They thought that they were doing good because her blood pressure was low and that she was dehydrated. They thought, hey, let's give her some fluids. But guess what? The fluids were running too quick. All right, let's move on to the next question. Great job. I believe you guys got it right. And here is the answer if you want to look at it and zoom into the strategy of it.